This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health today before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.
Dr. Tom Roselle and the Roselle Center for Healing present Ageless Health 2014, Proven Tools to Maximize Your Health, Saturday, October 18th at the Fairview Park Marriott in Falls Church, Virginia. At this all-day seminar, learn how you can feel better or feel great when the doctors from the Roselle Center for Healing each discuss a topic that directly affects your health, like your food, physical fitness, preventing injury and disease, your healing process, and more. Learn more at agelesshealth2014.com. That's agelesshealth2014.com.
Dr. Tom Roselle live right now on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle live in studio. Love to take your phone calls on anything that you'd like to know a little bit more about. Perhaps you've had a problem, you've tried, you've applied, you've done everything you can think about, but you get back to the same old place, right? Doesn't work. Nothing's working. Nothing's getting better. Well, give me a call. 888-630-9625. That's 888-630-9625. Love to talk to you on any subject that you have in mind. Let's get it done. Let's see what we can do from a non-drug, non-surgical point of view and, show you that you really have the opportunity to take control of your health. My book, Ageless Health, Health is a Do-It-Yourself program. Make sure you get a copy of that because it takes you through. It's a manual step-by-step of how you get it done. It's an interesting day today, interesting Sunday. I got up this morning, like I usually do, pour myself a cup of green tea, sat around and, do the reading I usually do and started making some notes for the show today. And I had breakfast and I walked around the house and walked out of the, into the car and drove up here. About a 25-minute drive, 30-minute drive from my house. And I got out of the car to come into the studio, and guess what? All those notes I wrote up this morning? I don't have them. So this is going to be a very interesting program. Fortunately, I do a little bit of reading along the way, and, so your phone calls will be useful today, and as they are always. I'm just giving you a hard time. Seriously, though, there's lots that we need to talk about, and we're going to start with something that I feel vindicated about for years and years and years. I tell patients and anybody that'll listen to me when I'm on a platform at a college or university or out doing a professional lecture of some sort, the slings and arrows, the problems with medications and drugs and so forth and their side effects. And some years ago, the drug companies began to use, particularly an outfit called Bayer, started saying that everybody, particularly from age 50 on, should take aspirin as a preventative medication, nonetheless taking it as a therapeutic mode if you've had a problem. Well, guess what? About a week ago, and we've been seeing a lot of this over the last several months, the FDA, yes, the Federal Drug Administration, Food and Drug Administration, those guys, well, they came out and they said, guess what? If you haven't had a heart attack, and even if you've had one, don't take aspirin. Guess what? 40 million Americans take an aspirin every day. And you may want to look at this morning and really take a look at it. It's all over the place. It's on every website you can think of that has to do with health-related anything. And after decades of promoting aspirin, the FDA now says that if you have not experienced a heart problem, period, and that's an occlusive type of heart problem where there's plaquing, you should not, hear me, not be taking aspirin even as a preventative. If you have a family history of heart disease, not even then. Not even then. It represents a significant departure from the FDA's original position on aspirin. And, to go specific and to read a quote that they said, FDA website, FDA has concluded that the data do not support the use of aspirin as a preventative medication by people who have not had a heart attack, stroke, or cardiovascular problems, a use that is called primary prevention. In such people, the benefit has not been established, but risks, such as dangerous bleeding into the brain, stomach, heart, are still present. Guess what? They're killing you. The article goes on. We're going to talk a little bit about this because you really need to know about this. Remember, Big Pharma is alive and well. Pharmaceutical companies make billions and billions of dollars on marketing to you the assumptions that certain things work. Guess what? Bayer makes $1.27 billion in sales from their aspirin every year. $1.27 billion. And they have most allopathic physicians all in on this. How many of you gone to your doctor and said, well, you know, you have a little bit of high blood pressure, or your cholesterol's a little high, or whatever it is. Here, you got to take aspirin. We might have to take aspirin for the rest of your life. And they were purporting that people, anybody above the age of 50, needed to take aspirin. They finally realized everything that I've been saying and other alternative healthcare practitioners have been saying for decades now are actually, you know, right on the mark. It's right. It's true. But the FDA finally said, wait a minute, slow down, not so fast. Guess what? And rightly, absolutely over the top. So evidence now, and, you know, it's coming into the mainstream, and we've said it forever, as far as aspirin preventatively doing anything, has gone to from, as far as we were concerned, and they were concerned, by the way, they already knew this stuff, from a weak proclamation to totally non-existent at best. And that's why for years and years and years I've been telling patients, don't do this. Don't take aspirin. There are better ways of handling clotting factors in the body. You know, your fish oils, your omega fatty acids, the proper ratios of omega-3, 6, and 9s. And you know why the FDA and the allopathic community and the drug company, Big Pharma, doesn't support this? Is because they can't trademark it. They can't franchise it. They can't, you know, own it completely. And so they can't jack up the price and make tons and tons of money. In fact, you know, going to the debate, this debate whether or not aspirin has any protective benefits against cardiovascular disease, and if you've suffered a heart attack or stroke, is still going on in the medical community. We know the studies are out there that it doesn't work. You know, recent studies have uncovered numerous side effects, and they suggest that whatever aspirin may offer is dramatically, and I underline dramatically, significantly overshadowed by the disaster that it can cause in the body. There are many other natural ways. So we look at this for all medications, but here's something that they're promoting as a preventative, and they're killing you. It gets into the stomach, and it just rips up your lining. It causes you to bleed. It's causing the brain to bleed. It's causing the heart to bleed. So here's the rest of the story. Aspirin may conceal a cardiac event. That means you could be in the middle of developing a heart attack, and it can mask it. 800,000 Americans die every year from cardiovascular disease. It includes heart attacks and strokes. And this is why there's been such a major health focus on everything. And so why aspirin was hailed as the wonder drug for all of this stuff and being safe and as a preventative. But guess what? It finally blew up in their face. 10 years ago, there was a guy by the name of Cleland. He's a cardiologist from University of Hull in the United Kingdom, and he wrote an amazing article, and it was published in the British Journal of Medicine, casting doubt on the efficacy of aspirin for anything, let alone cardiovascular problems. Based on a series of meta-analysis, they did a huge trial. The antithrombotic trialist collaboration, you know, which is an enormous body of research following more than 100,000 patients. This was no small study. 100,000 patients at high risk for cardiovascular events. And Cleland concluded that aspirin therapy was not saving anybody, not one of them. Rather, aspirin seemed to change the way the event actually presented itself, but not stopping it in any way. Cleland also found that studies touting aspirin benefits are flawed. The interpretations are based on what you want to get out of them. And, you know, the original study, a deluge of scientific studies have, you know, further exposed aspirin as a monumental over-the-top failure and something that you've been deluded upon for over, you know, a decade to 2 to 3 decades. It doesn't work. So if you're on aspirin, I would encourage you that there are better ways. The dismal failures are amazing. And, you know, let me give you a little bit of a read on the journals. There was a study by the American Heart Journal in 2004, and the significant finding was patients receiving aspirin treatment showed the worst cardiac outcomes, especially heart failure. It made things worse, and this goes back to 2004, 10 years ago. The New England Journal of Medicine, 2005, a 10-year study at Harvard, the best prestigious university. Everybody said, wow, Harvard? Wow, Harvard. 40,000 women found no fewer heart attacks or cardiovascular deaths among women receiving aspirin therapy. It didn't change the outcome. British Medical Journal, 2009. Aspirin therapy for diabetics produced no benefit in preventing cardiovascular disease. The pharmacoepidemiological drug safety of 2009, a study, this was done in Sweden. Swedish researchers studying individuals with diabetes found no clear benefit for aspirin. None. But they also noted that, guess what? It increased the risk of serious bleeding in the body. These can cause strokes. These can cause heart attacks. These can cause erosion within the system. The Journal of American Medical Association, here we go, this country, right, 2010. They reprinted a study that was done in Scotland and said that the study found that aspirin did not help prevent heart attacks or strokes in healthy people and asymptomatic individuals with high risk of heart disease. So they were looking at it as a preventative. Does it help? No. But your doctor keeps telling you, take it. We're going to prevent you having a heart attack. Journal of the American College of Cardiology, 2010. Here's the keynote. These are the guys that are the go-to, right? Patients taking aspirin showed a higher risk for recurrent heart attack and associated heart problems. So if you had a heart attack, they put you on aspirin, you got a greater risk of having another heart attack. Yeah. So guess what? When you're told to take a certain drug, ask the question, and start looking it up and realize that a lot of people have their hands in the money till, and they do things simply because they're padding their own pockets. Aspirin increases your risk of bleeding, period, end of story. It increases your risk for brain bleeding, stomach bleeding, heart bleeding, tissue damage. Bump into something, you're going to bleed. It's just as bad as, the blood thinners like Coumadin, which is warfarin, by the way, rat poison. Remember that? Aspirin destroying the stomach lining is very significant. And guess what it does? Once your stomach lining is protective. You need it. It's the first line of defense to so many other things. And once you erode this thing, not only are you increase your risk of stomach ulcers, gastric ulcers, duodenal bleeding, things of that nature, but in addition to that, you dramatically increase your risk for other types of bacterium to come in and attack you, like H. pylori, dramatically increasing your risk for Crohn's disease because that's the gluten sensitivity. So if you don't have a stomach barrier, then the gliadin antibody goes through the ceiling, and you have an increased risk for celiac, Crohn's, gluten sensitivity, toxicity, and so forth. This ain't fun, friends. This is something that, we're the guinea pigs. We're the laboratory. They've known this stuff forever, but you know what? It's big dollars, $1.27 billion into Bayer's coffer every year. That's just one drug. That's just one drug. You don't think these companies control everything that happens? There's a Japanese study that found that the higher incidence of bleeding at ulcer sites with patients taking aspirin and, low-dose aspirin therapy versus those not taking aspirin therapy. And they found that, people that weren't on it did a whole lot better. So a whole lot of bad news for Bayer because each year 15,000 people die and over 100,000 people are hospitalized as a result of aspirin and other enzymes. By the way, aspirin is an NSAID, a non-steroidal anti-inflammatory, just like Motrin and Advil and all those other things. Same type of stuff, except this is a little bit more caustic. And those estimates, by the way, are the ones that are reported, so they're probably very conservative relative to what's actually going on. Step back, take a look at it, be your own protector. Aspirin may be one of those oldest drugs out there that may be killing more people than, car accidents and so forth. There's a lot of evidence out there that aspirin overdose is a major contributor to the death tolls that took place in the 1980 flu epidemic, influenza, where people died by the hundreds of thousands all over the world when they gave them aspirin. Aspirin toxicity can result in hemorrhage and builds up fluid in your body that you can't get rid of in your lungs. And guess what it does? It causes death. So check it out. Don't believe me. I want you to go type this in, go to FDA's reversal on aspirin, and we're going to talk a little bit more about this. But meanwhile, we're coming up for a break, and we have to pay attention to people who are bringing you Dr. Tom Roselle Live and all this inflammatory information that I bring you. But I'm here for you all the time, bringing you this type of information. It's the only place you're going to hear about it first, right? 888-630-9625. That's 888-630-9625. Love to talk to you. We're going to talk a little bit more about that. We're going to talk about some interactions of other things. Don't go away. We'll be right back. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio, bringing you some very inflammatory information today, things that you need to know about. We're talking about aspirin. And, if your doctor's telling you to take it, you got a problem because it's increasing your risk of all kinds of things. It depletes nutrients within the system as well. Things like vitamin C, vitamin E, folic acid, iron, sodium, zinc, potassium, and as well as impairing your production of melatonin. We've talked about melatonin decreases anyway as you get older. That's why older people have a more difficult time sleeping in many instances, because if there's any kind of light on, you fall asleep in front of the television or computer screen, melatonin is depleted, so you end up with a problem. And so in addition to all this nonsense, aspirin causes an increased problem with that. But here's some other things that you need to know about, and we won't belabor this because there's so many other things I want to talk about today. If you're taking aspirin, an increased risk of one type of breast cancer in women, and it's the estrogen-progesterone negative receptor, and increased risk of kidney failure, cataracts, macular degeneration, and, oh, by the way, blindness, hearing loss, and tinnitus. And guys, pay attention. If you are on aspirin because your doctor thinks you have a risk of cardiac problems, you've just increased your risk of ED by 22%. So if you already have a problem and you're taking an NSAID, you're taking an aspirin, you just cause yourself more problems than what you thought about. And that was a study, by the way, that came out that was published by Kaiser, Kaiser Permanente, and it wasn't a small study, there was just 80,000 men. So you got to pay attention here, my friends. If you don't, you're going to have more problems than you want to deal with. And you need to really optimize what you're doing for yourself. Health is a do-it-yourself program. Please, 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 please pay attention. Do the things that you need to do. It's like get your own information and make sure that you're doing what you can do. You're doing what you should do every day. We're going to talk a little bit about testosterone. We're going to talk about some other things. But this program's for you. 888-630-9625, 888-630-9625. If you'd like to know what to do if you are on aspirin and how to get off of it, or, what to do in substitution of that, happy to tell you that. Just give me a call and we'll talk about your specific situations because it's going to affect everybody else. There's a doctor that I have tremendous respect for, and I've known him for many, many years. His name is Dr. Walter Schmidt. He's out of North Carolina in the Tri-City area. And Dr. Schmidt has more credentials than you can possibly, from nutritional credentials to applied kinesiological credentials. He's also has a diplomate in neurology and so forth. And he is well known in the interprofessional circles worldwide. And he's always publishing things. And he talks about indicator testing when it comes to doing anything, because anything that you put in your mouth, anything that you're exposed to, your body is the indicator if you're paying attention. So in a recent article that he was quoted, and he was talking about precise nutritional interventions that can be determined for patients with musculoskeletal pain or patients who have decreased range of motion, and using indicator testing. What is indicator testing? Testing for nutritional supplements with very specific orthopedic and neurological parameters, range of motion, reflex patterns, muscle pain, radiation areas, and so forth, right? So if you take something and it doesn't make something that is measurable better, then it's not working for you. A lot of us get into the hype of take this because, and they come up with all these wonderful things in Fifth Avenue marketing that you should be taking it for. But the thing of it is, if you can't measure it, if you can't show a positive response, then it shouldn't be used. In my earlier years of practice, Dr. George Goodhart, who was the founder of the clinical application of applied kinesiology, was the first chiropractor who ever served on the U.S. Olympic medical staff, and this goes back to 1980 at Lake Placid Olympics. And Dr. Goodhart always emphasized the importance of using something other than muscle testing to be able to measure as a clinical assessment outcome tool. And, Dr. Goodhart said, that you have to measure. And he said this I think it was a dozen times. And, it got into my head that if something doesn't change something, then it's not worth using. It's not making the result. If you can't see a shift not only on a biochemical test, but also on a neurological and neuromuscular test, it's not working. So if you take something, you should see a change in something that's related to it. And that's one of the things that we want to do. And what we do in our practice is we try to measure outcomes. We measure it with electromagnetic fields. We measure it with muscle testing. We measure it with range of motion. We measure it with pain sensitivity testers throughout the body. And when you use something nutritionally, it should have an outcome. If it doesn't have an outcome, then it's not working. And many of us go to the marketplace and, we buy whatever because they said it's going to work. But are you truly seeing an outcome? There has to be indicator testing to support what it is that you're doing. We're coming up to a break, and when we come back, we're going to start taking your phone calls because the phone lines are lighting up like crazy. Don't go away. This is Dr. Tom Roselle. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Dr. Tom Roselle and the Roselle Center for Healing present Ageless Health 2014, Proven Tools to Maximize Your Health, Saturday, October 18th at the Fairview Park Marriott in Falls Church, Virginia. At this all-day seminar, learn how you can feel better or feel great when the doctors from the Roselle Center for Healing each discuss a topic that directly affects your health, like your food, physical fitness, preventing injury and disease, your healing process, and more. Learn more at agelesshealth2014.com. That's agelesshealth2014.com.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live in studio, 888-630-9625. That's 888-630-9625. Love to talk to you. Let's discuss your problems and see what we have to do about them and how you can get away from some of the medications and potential surgeries and things that you're kind of looking over your shoulder at, not necessary in most situations. Let's go to the phones. May, how can I help you? Thank you for calling and being patient.
Hi, Dr. Roselle. It's the first time I've ever called into a radio show.
Well, welcome.
Thank you. I have chronic atrial fib, and for the past several years they have recommended, and I've been on a baby aspirin, they say, to avoid stroke. They changed the rules, and the CHAD score say take a baby aspirin. Now there's a new CHAD score. I don't know if you're familiar with it.
Very much so. Go ahead.
Take the Pradaxa, the Xarelto, blah, blah, instead of the Coumadin. I'm quite suspicious about the drug companies instituting this new CHAD score. Anyway, I'd like your opinion on if you have any thoughts on the effectiveness of a baby aspirin for stroke and or these other drugs.
May, let me ask you a question. How old are you?
Almost 70.
Okay, good for you. You got a voice that's a very young person. Good for you.
Yes. They changed it. It used to be they said take Coumadin, but then take Coumadin after you were 75 if you didn't have diabetes.
Well, see, that's just like them telling you that years ago that every woman should have an annual mammography, right? Then
or the bone density or the HRT.
Sure.
Yeah,
but what they were doing is they were killing women. They were giving them cancer because you take the breast tissue, crush it, radiate it, and you increase your risk. But that's a different story. Right. So let's talk about aspirin a little bit. All right.
Okay.
So,
and then the Pradaxa and the Xarelto and all of that.
Okay, we're going to take one because I'm sitting here with like 12 calls, but we'll do the best we can.
Okay.
And some of them are overlapping, so I'll get to them anyway.
Okay.
Aspirin is used because it's a blood thinner. But the problem is, as a blood thinner, it causes bleeding. So when the aspirin, and it competes for other receptor sites and so forth, we can talk about aspirin when it comes to fevers and Ray's syndrome and all of that nonsense. But as aspirin works in the body, it stops the clotting ability of the blood. But in doing so, it also has, because it's an acid, it erodes and destroys tissue. So now you're bleeding, and you're bleeding when you bump into stuff. So, people who are taking any kind of blood thinner, we notice that they black and blue much more easily than somebody else. They don't stop bleeding like other people do. But it's just not superficial. It's happening inside the body as well. That's why it's increasing the risk of stroke, and it's increasing the risk of heart attacks and gastrointestinal problems and increasing the risk of certain types of cancers, particularly breast cancer in women, and causing kidney damage because the small little tubules, the little arteries in the kidneys are susceptible to this. So now you're hemorrhaging all over the place. Your blood count goes down. You increase your risk or your need for things like B12 and folic acid because it's chewing that up, it's eating it up. You can't digest it. Your barriers of protection have gone away because the gastrointestinal area is the first line of defense in so many different things. So aspirin is a problem, and it's one of those things that have been used for centuries. It'll bring down a fever, but fevers are there for a reason. It will help decrease inflammation, but you don't want to knock all inflammation down in the initial stages, only chronic problems, but you want to answer the question, why is the inflammation there in the first place? You have chronic atrial fib. Okay, so you have to look at why is the heart misfiring to begin with. Let's ask the question, why is that, before we jump in and try to do something about the end product, the symptom process. The further you go back in up the stream to find out why, the more effective you can be in the body. Take a look at the heart. The heart has 3 neurological sources. It has a pacemaker. It has nerves from the back called the splanchnic or the parasympathetic nerves. It has a nerve from the brain called the vagus nerve. All these guys help regulate the rhythm of the heart in conjunction with certain mineralization, particularly potassium, sodium, magnesium, other trace minerals, and they allow that system to fire. Now, you have, and from my field, we're going to look at the entire input. We're going to look at blood supply to it. We're going to look at toxic levels of the body. We're going to look at the acupuncture circuits that service the heart and other tissues as well. And ask the question down the line, is there toxicity? Was there any heavy metal exposure over the years? Was there any damage or injury? Was there any trauma to the skull or the spine? Those things are all critical in evaluating why something happens, why you may have this chronic tachycardia. It's not okay just to give something like an aspirin to prevent, maybe just in case, because that misfiring will cause some clotting. That's the way the medical community is thinking. Well, do something that's less intrusive and less deadly. Like, you can go to your fish oils or your borage and flaxseed oils and so forth. You look at your diet. You see, my mantra: sugar, sodas, coffee, teas, fast food, fried foods, alcohol, gluten, additives, preservatives. Take a look at those things and see if they're in your diet. See if you're eating appropriately to, so you're not having a leptin war in your body, and you're actually increasing the thickness and the clotting factors within your body. So you have to look at it. So just off the top, and we're not going to solve your problem right now, but I'm trying to give you things to think about. Look at your diet. Make sure that it's being supported with good, fresh vegetables, that your body's extremely alkaline. Make sure your stress level's low. Make sure that you're not putting up with pain in your body, because that's an indication that the neuromuscular system's not working, and you need to see somebody like me or somebody who does the work that we do in our practice. So you take a look at the entire history of you as a human being relative to injuries and so forth, and make that diagnosis based on those things. If I can help you further, May, I'd love to get into this. Actually, I'd love to spend the whole program on your question, because it hits.
That's very helpful. My fear, I'm currently on flaxseed and fish oil and all of that. My fear, if I go on these other drugs, which I really don't want to, then I can't even take those.
The thing is, they're not going to want you to take them. Yeah, they're not going to want you to take them. So,
that's right. Then my system will get worse.
But if I was you, or you were my wife, if you were Sue, you wouldn't be on any of those things. There'd be other ways of handling that, and I'm happy to talk to you about that. Give me a call, and we'll discuss it. Thanks, May.
Thank you. Bye.
Charlotte, let me help you out. How can we help your stomach acidity?
Dr. Tom, I'm a patient out at the Roselle Center.
Oh, I know who you are. Yes. Hi, hon. How you doing?
Well, I'm a mystery to everybody. I have this pain in my left side, and we've done all the tests and everything. Is there a test or something that we can measure the amount of acid that's in my stomach? And is there a way other than a colonoscopy that I can find out if there's a pocket or something of gas that's over on the left side that's accumulating, that's causing the pain?
How far over to the left? Under the rib cage to the outside?
It's the outside of the diaphragm and down to the hip.
Okay, that can be
space in between, where the love handles are.
Okay, that can be a couple things. That can be the descending portion of the colon, and it comes from, it's called the splanchnic flexure or the splenic flexure, and it goes all the way down into the rectal area. It can be something that's in there. It could be that the fascial levels, the layers of fascia aren't holding and supporting the way they should be. There's a long muscle that comes off your hip. It attaches to the ribs. It's called the quadratus lumborum muscle. When that muscle is not firing properly or it's reacting to other areas, then it's going to put pressure on the intestinal system and make it feel like it's an organic problem. Can you measure the acid within the stomach? At that level, that where you're indicating is not a stomach; it's more of an intestinal tract situation or a neuromuscular pattern in my brain without checking it, without looking at it.
Before this, the thing that was getting me, we thought it was a gallbladder because there was so much gas and everything.
Wrong side.
Well, I know it's the wrong side, but that was the first thing. So Sue's got me eating everything cooked and eating gluten-free diet. So.
When you're in the office next time, I'm going through my headspace and thinking about you and thinking about your physiology. Grab me. And there's a couple things that I want to check. I want to check a couple of those patterns. Over on the left, relative to organ systems, besides the colon and the small intestine laying in between the large intestine, you've got the lateral aspect of the fundus of the stomach that's sitting there. But that's from what you're describing, it's way too over to the side for it to be that possible. Yes, you've got the spleen, you've got the pancreas, they're over on that area. But you've got a lot of other neuromechanical patterns that are sitting in there as well. Off the top, I don't think it's acidity. Can we measure the stomach acid? Yes. There's a Heidelberg test that we can do. That's really not totally invasive. There's some other things that we can measure that way. But my brain right now is saying that that we have some sort of neuromuscular component to this thing. Grab me and let's talk.
Okay.
Thank you. Thanks, kiddo. Bye-bye.
Bye-bye.
Eloise, how can I help you?
I'm so glad to speak with you. I wondered what would cause vaginal bleeding. Specifically, would aspirin have a part in it, or would there be other causes of vaginal bleeding?
Well, there's many causes of vaginal bleeding. Aspirin can intensify it because it's going to cause the membranes to be more susceptible to rupture, but hormones are primary. How old are you, Eloise?
Oh, 80.
Okay, so hormones are a very serious consideration for someone your age. If your estrogen levels are low or your estrogen progesterone balances are off, there's going to be more of a susceptibility to vaginal bleeding from either from intercourse to just wiping to just spontaneous onset. The dryness of that area will cause it to occur. So you have to look at a lot of different pieces of it. I don't know your health at all. I don't know what your hormones are.
Well, I want to ask, would polyps be a reason?
Polyps could very much be a reason, but those usually aren't vaginal. They're usually uterine. And
I'm saying it's a vaginal comes out of your front part, not your rear end. So I call that vaginal bleeding. So I don't mean internally.
No, I understand exactly what you're saying. That could very much be the issue, but the vaginal vault itself, can you get a polyp within the vaginal vault or an irritation or a thickening of the tissue? Yes. Is it usual? Not generally. It can be other things. It's a gynecologist could tell you straight up if there's any kind of breakdown of tissue, if there's any polyp formation, if there's any scar tissue. A good examination will tell you that and also tell you whether or not you have drying. You can do blood testing to determine whether or not your estrogen, progesterone, testosterone levels are off. We choose to use a saliva test for hormones simply because of the fact that it gives us the most available hormone. You can have low levels of hormone in your body, but if it's being transported adequately, if you're getting it into the tissue, then that's good enough, and you don't have those problems. But if there's a barrier that's prohibiting the transportation of those hormones, and that barrier could come because of receptor site competition to other things, it can be because of a generalized inflammatory level. There's a lot of different reasons that you have to find out, but those are some. But basic testing.
Could I ask this question? Are there any other tests that are non-invasive, like, let's say, a sonogram or an X-ray?
The first thing that you want to do are two things. You want to have a gynecological exam and you want to have either blood test or salivary test to determine hormone levels. Eloise, I hope that helps. It's one that we have to look at very specifically, and each case is very different than the other. But at your age, the first thing I'd be looking at is hormones. Sarah, how can I help you? Thank you for being patient.
Oh, thank you very much. All right. I have an appointment for an echogram. My background is that I've had AFib, I'm anemic, I have PBD, all right, and also colitis. And my doctor put me on a blood thinner, and I'm very concerned. I haven't started it as yet. What to do? I'm concerned about the hemorrhaging you're talking about.
Well, it's a significant concern, Sarah. In my opinion, and what we know about the body biochemically and nutritionally, when you start altering these things and you go on blood thinners and so forth, and there's no real risk of significant clotting, you're looking at a gun, in playing Russian roulette. And sometimes there's more than just one bullet in the chamber. So you have to take a look at everything. If you don't have a history of infarct where you've been clotting and subsequently you clotted or you broke a vessel because there was a lot of plaque in there, then any kind of blood thinner, in my opinion, based on the things that that we do, is maybe not the right course to take when there's other natural things that you can do that will thin the blood just as well. Again, I go back to the fact that one of the primary reasons, in my opinion, that the allopathic community doesn't use things like fish oils and flaxseed oil and borage oil and so forth is the fact that they can't own it. You cannot copyright something that is natural, and that's the biggest problem. So they go to the drug aspect instead of going to the natural aspect. There's things out there. You have to look at your diet. You have to look at your exposures. You have to look at all of those things. There's other ways of doing that. Sarah, if we can help you in any way, love to do that. Give us a call and get in to see Sue in our nutrition department. Happy to work through the process with you and give you some direction, at least give you some very specific information for you to make some intelligent choices on.
Right. My diet is very poor because I'm afraid to eat anything due to the colitis.
Yeah, no, there's ways of fixing that, Sarah. Truly, there is ways of dealing with that. You don't have to suffer. Give us a call, make an appointment with Sue, and we're happy to help you out in any way that we possibly can. Bill, thank you for calling, my friend. How can I help you?
Hi. Thanks for taking my call, doctor. Sorry, can you hear me?
Yep, I'm good.
Okay. I've got a pain in my right side, northwest of the belly button, about maybe 2 inches below the rib cage, and maybe gallbladder. I don't know.
It could be.
I was drinking a lot of beer, pretty regularly, and the pain became acute. I thought the beer was causing it, so I gave that up. I haven't had any in, 10 or 11 days. The pain dulled, but it's still there. And thing is, I don't have medical insurance, so I'm wondering if
Bill, it sounds like a gallbladder liver problem. And what I would do is I would clean up your diet completely and eliminate the alcohol for up to 30 days. It should get progressively better. Look, I'm going to hold you over because I want to give you a couple more pieces of information, but I have to break for some commercials and some for information. So stay on the line, and then I'm going to give you a couple more pieces of data.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
Welcome back. This is Dr. Tom Roselle. You've been listening to Dr. Tom Roselle Live. We've had a wild woolly show today, giving you some very inflammatory information on aspirin. And finally, the Bayer company has gotten their shorts nipped, if you will. You know, their $1.26 or $7 billion a year that they're taking in at your cost is now shown to be spurious. Yeah, I'll be kind. There's other things I want to say, but right now we'll leave it at that. That way I won't get in any trouble later on. Let's go back to the phones. Bill, are you still there?
Yeah.
Thanks, buddy. Thanks for holding on. Listen, let me give you a couple quick on that. The fact that you had gotten into drinking some beer on, pretty heavily, and you started with the pain that's, at the gallbladder liver area underneath the rib cage, tells me a couple different things. One, off the top, the first, we're going to go in order. There's definitely a liver gallbladder problem. You stop drinking and the problem's still there. That means there's still high levels of inflammation that are causing you some problems. But if it continues to get better, get better. But if that's the case, man, you're done drinking. You cannot touch the stuff. It can be in most beers. Beer has gluten in it. That's the hops and the barley and the malt and so forth. And so if you have any type of gluten sensitivity, you're going to be super sensitive to beer. And so that adds and compounds the problem. Now, could there be other reasons? You could have some obstruction in there. You could already have some problems with initial stages of, certain types of conditions. So I would encourage you to let it go for about another 2 weeks. And as long as the pain gets better, then at that point, get yourself some blood work. Get yourself to see somebody that you really know what's going on so you can make some changes dietarily. Your diet has got to go alkaline. You've got to eat every vegetable that you can get your hands on. You've got to stay away from any kind of wheat or grain or gluten products. Period. End of story. You can't cheat a little bit. You have to make sure that you're drinking fresh water and drinking at least 2 liters of water a day. You can have a little bit of fruit, but not a lot. Mostly berries and that sort of thing. 1 serving, half a cup, maybe 3/4 of a cup a day. That's your max. You can divide it up and eat as much as you want. But if you continue to feel that way, don't eat anything fried. Don't eat anything that has the bad fats, any chips and things of that nature, because it's going to make matters worse for you. It's going to make life ugly. So do those things. See what the outcome is. 2 to 3 weeks, you should be better, but then do yourself a favor. Get somebody to look at you and help you continue the process. Bill, that's the best I can do right now. Take care of yourself and let me know if we can do anything more to help you. Patrick, thank you for holding. Appreciate your patience.
Yeah, like a previous caller, it's the first time I've called into any type of radio show.
Well, welcome. Thank you.
Only because I've been on the road half the time I listen in. I'm calling on Tuesday on behalf of my daughter.
Okay, Bill, Patrick, I got 1 minute, so go ahead, quick.
Okay, well, my daughter, during this past year, she's had 3 urinary infections, 3 different occasions.
How old is she?
She's 14.
Okay.
And every time she has a period, she develops a severe stomach pain. She's pain around that area where she has a period. And since she's been 6 or 7 years old, every time she's had bowel movements, she's developed stomach pain from that. And recently, we had her to the doctors that x-rayed her, and she has a lot of gas in her upper part of her body and all. And
okay, let me. I'm gonna have to give you some real quick checkpoints because we're coming up to the end of the program. One, sounds like she has could have high levels of mold or fungus. It could be some low-grade bacteria that's in the system. Mold or fungus comes off the top. If she has a tendency to eat a lot of sugars and fast foods, it's going to make it far worse. If she has nerve roots from her low back that are irritated, it's actually going to increase the problem. Patrick, I wish I could get into this because I'd love to help you out. Send me a note at rosellecare.com and I'll give you some more data. But thank you for your call. Call back next time. Hopefully I can continue giving you this information. This program obviously should be a whole lot longer. We'll see you next week, as we do every week at 12 o'clock right here, same old place. This is Dr. Tom Roselle.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle and the Roselle Center for Healing present Ageless Health 2014, Proven Tools to Maximize Your Health, Saturday, October 18th at the Fairview Park Marriott in Falls Church, Virginia. At this all-day seminar, learn how you can feel better or feel great when the doctors from the Roselle Center for Healing each discuss a topic that directly affects your health, like your food, physical fitness, preventing injury and disease, your healing process, and more. Learn more at agelesshealth2014.com. That's agelesshealth2014.com.
Thank you.